Okay, you'll be here too. Okay, so thank you everyone for being here and for having me present the information about acupuncture and Chinese medicine. I'm deeply humbled and feel very honored to speak before you. I started my journey as an acupuncturist first as a massage therapist, and so I'll touch on some bodywork elements too, just so you get to know about my practice and what I've learned from my clinical experience. And then I'll also present some of the evidence, and then I'd love to learn from you how you approach lymphedema in your practice, so we can learn together. I have had a private practice in La Jolla, California. I still have it, but it's being run by a colleague of mine, Mitch Schreiber. I recently took a full-time job at City of Hope, so now I'm practicing acupuncture at a cancer center, which is much different from private practice, and I'm reminded of that every day that I go to City of Hope. So I stand before you having kind of transitioned into that, but I'm so grateful to be reminded of how much, as a Chinese medicine practitioner, and the code of Charlotte Maxwell is to think outside of the box and to bring just common sense solutions to problems to people at the ground level, and to work together to bring, safe solutions for people who really need it. And so, I'll present evidence, and then I'll also talk about kind of the common sense solutions I had in my private practice. So I'm going to go over there so I can advance some slides, and then I'll come back down here because we're going to talk a little bit about acupressure and how to use acupressure, how to instruct acupressure, and acupressure points that were part of the research roundup. And sadly, I'm not local to the area, so I've only been as a volunteer in person a couple times, and I wish I kind of lived closer and I got to know you guys all better. There was something I was going to say about that, but I wanted to, I first started my acupuncture training at ACTCM in 2010, and then I decided that San Francisco wasn't a place that I was going to develop my practice, that being that I was from San Diego, that I would just transfer down to San Diego, and I finished my training at PCOM. It was called PCOM at the time. Anyone else, ACTCM? Yeah. So there are biological and genetic factors or contributions to lymphedema. So there are pathophysiological and genetic factors contribute to lymphedema developing in the body. It's mostly it's mostly about inflammation. And so in the study in the research roundup, the Shen et al., Shen, Li, Ning, Han, promising application for acupressure for management of cancer-related lymphedema. In that review, they look at cytokines and how the effect on the measurement of cytokines and the reduction of inflammation in the body with the use of acupuncture and acupressure. And the chronic inflammation, that points to chronic inflammation is a well-established risk factor for lymphedema. And I thought it was very interesting earlier today that talking about health disparities, chronic inflammation comes from not being able to get the food that you need and the housing that you need, being in constant stress, to not getting, being able to have a support system to address trauma that you may have experienced. So all those kind of things can contribute to living in a state of chronic inflammation. So acupressure is one modality that we can use and teach our clients as Chinese medicine providers to modulate inflammation. And in fact, acupressure is showed to have improvements in lymphedema management, in limb function, quality of life, and inflammatory factors. And there are these points that were most commonly come up in the systematic review to have worked well. So these are ones I'd probably start with because they've been looked at and have shown great results. There are other points as well. So pericardium 6, large intestine 4, gallbladder 21, large intestine 11, lung 5, most commonly have been used. One reviewed study investigated acupressure's effect on inflammation, and the rest in the review looked at acupuncture. So levels are significantly lower in the acupressure group compared to controls. And so this suggests that acupressure may help regulate inflammation and lymphedema and management. And here I show a picture of the lymphatic system. So the circles are the actual bundles of lymph nodes. So here it's showing, kind of roughly the cervical chain, then the axillary bundles, and then the inguinal area. And then, of course, pericardium 6 doesn't fit into that, nor does large intestine 4. But in using acupressure or gallbladder 21, you can actually be sweeping into the terminus. You can actually be helping with opening up the neck area. Large intestine 11, it's close enough to the cubital crease, which is also a major area for getting lymph fluid to go back into the circulatory system. And also lung 5 serves that function as well. And I love how we talked about earlier too, and when you're doing, when showing, maybe developing a protocol, this is something to really consider. Maybe you want to start with some abdominal breathing and then working up, opening the terminus, and then also the major lymph node bundles. That would kind of dictate what points, what order the points would be in. So I'll come back to that. So if you're looking for evidence-based literature, there is a website. It's actually developed in the UK. It's called Evidence-Based Acupuncture. I don't know if anyone's heard of this group or donate to it. They have some great white papers, and it's still very much in the works. But they have some really great diagrams and summaries. So if it's worth it to you for the $79 a year to have access to it, I highly encourage you. And I think they also ask people to contribute. But I just wanted to point out that I think that made a really good point that the mechanisms of acupuncture for relieving pain, which comes into play when you're looking at someone who's suffering with lymphedema, they've been extensively researched for over 60 years. And sensory nerve pathways involving specialized nerve fibers, they list them here, and descending nervous system pathways have been mapped. Numerous biochemicals have been identified, including opioid and non-opioid neuropeptides and neurotransmitters such as serotonin and norepinephrine, dopamine, cytokines, glutamine, nitric oxide, and GABA. I'm still in reading the research, learning more and more about that, all those different ways in which the acupuncture has an effect on the body. The nice thing to know, it kind of brings the whole body together, and it also points out that the body doesn't act alone in any sort of function. So in placing one needle in one point, it's actually engaging all the systems of the body. So I'm bringing that up because in talking about large intestine 11, which is part of an you can use it in acupuncture, also in acupressure and acupuncture with moxibustion techniques. How, maybe you're curious about how it works, at least I am, or at least explaining. A big thing, I think, with the informed ongoing consent is to let people know why, perhaps when they ask, like, why are you choosing certain points, or maybe even just to slow the pace down, you know, bringing attention or talking about what points you'd like to use. And maybe you'll get that person who wants to know a little bit more detail. So acupuncture activates this inflammatory reflex, or how the our nervous system, our immune systems kind of work together. And acupuncture is able to modulate immune defense through nervous system immune interactions. So it's been studied that if you stimulate large intestine 11 bilaterally and probably on its own, it increases the cellular defense state of neutrophil granulocytes, and it produces a strong immune activation. So commonly, this is the go-to point for eczema or heat in the body. So I think it's just very interesting how in its location that it can have that effect on the body. And I pulled this from an article about the biomedical information therapy that is known as acupuncture from 2016. And they're starting to map out all the points now. I don't know if anyone's engaged with the Society for Acupuncture Research, but they're doing like a topographical map and scanning the whole body and looking at 3-dimensionally, like, what is underneath this acupuncture point, and how is it that it creates this cellular defense state, and how does it engage the brain and all those things. Tara, yes, it's called Tara, and UCSD is involved in it, and some other institutions. Yeah, it's very exciting. All right, so clinical relevance. So acupressure shows promise in downregulating inflammation relevant to lymphedema, and acupuncture also is able to modulate our immune defense through this interaction between nervous system and immune interactions. And there are many more interactions that I'm not hitting on because I'm still working on that bioscience and basic science understanding of how acupuncture works and talking about it to a group of folks. So, all right. Together, these findings provide a mechanistic basis for understanding or using acupuncture and acupressure as supportive therapies in lymphedema, as well as any inflammation-related condition. So how is this relevant to Charlotte Maxwell, other than, acupuncture is already in practice there? Well, acupuncture, as we know, it can be, it is cost effective for some, but can, if they go to someone in private practice and they don't use their Medicare benefits and go to an institution, it's very expensive and it's out of reach. But acupressure can be easily accessible. You can learn how to do it for yourself, and there's no time constraint or setting constraints. So I think it would be nice to, if someone coming to you and they have lymphedema, you're using acupuncture, to take that opportunity to slow things down and talk about acupressure, even just starting with one point, even just starting with LI11. And that way they can, if it's one way to check in with their body, and then build from there. Don't feel like you have to go through a whole protocol unless the person's receptive to that. And if you do go through a whole protocol, I highly recommend maybe having a printout so they can take that with them. So it was brought up about, and even on the quiz too, I'm glad that was there. And I still get asked this question a lot, even at clinic. is it safe for me to get acupuncture where I've had lymph nodes removed in that arm? And it's not, they have probably, especially if they're a survivor, and they were diagnosed in the early 2000s, the confusion is there because the guidelines that were put out at the time were that it wasn't safe. And so there's a paper that was published by the Society of Integrative Oncology in 2009, and they go on, it's very prudent to avoid acupuncture in limbs with lymphedema, and they go on about other things. But and then came along a Memorial Sloan Kettering, and there was a pilot study led by one of its pioneers, Beth Gasalith. I hope I'm pronouncing her last name correctly. So in 2013, they were looking at, well, can acupuncture help reduce lymphedema? Unfortunately, it didn't reduce it that much in that pilot study, but it caused no harm. There were no adverse effects. So the conclusion of that study was that acupuncture for breast cancer-related lymphedema appears safe and may reduce arm circumference, although these results await confirmation in a randomized controlled trial. Acupuncture can be considered for women with no other option for sustained arm circumference reduction. It's kind of no other option there. And that's put there because it's still, if someone has lymphedema and they're being seen at Memorial Sloan Kettering, their first referral is to occupational therapy, not acupuncture. And today, the guidelines from American Society of Clinical Oncology is that we're still very much adjunct therapy. But what's exciting, the studies that coming out of China is that acupuncture or acupuncture moxibustion or acupressure with conventional therapy like complex decongestive therapy actually has better outcomes than just that therapy alone. So next I wanted to, I wasn't anticipating that it'd be in front of the mic and it would be recorded, and that there would be more kind of a round table and we'd have more open discussion. So, so feel free to just, if you have any questions or any insights, if I say something, just let me know. Yeah. Yeah. Yeah, very good question. There was the Shin study, and I don't have it printed out in front of me, but they were comparing the two. I think they most talked about like the cost effectiveness and accessibility was, they have a lot of pros for doing acupressure. And I think it was such a small, even with a systematic review, such a small collection of studies that even the acupressure was just one study. So I don't think they can say yet like whether one is better than the other. But the question of acupressure or acupuncture, it has been shown that acupuncture versus acupuncture with moxibustion or warm needle moxibustion, as they term it, is better than acupuncture. So yeah. But I think any case with lymphedema, what's so frustrating about lymphedema, even if you get the decongestive therapy or CDT, it comes back. It can come back. It can come back very quickly. So you really have to. The person has to be encouraged and feel supported and empowered to do some self-care every day and make it as part of their routine. So that's where the acupressure could come in, the towel massage, having certain teas and things like that. Doing the daily walks, exercise is really important. And we'll get into even some simple qigong, which we are very knowledgeable of. We could show them simple qigong exercises that are very good at engaging Sister Kylie, and very helpful with lymphatic system. Even like the bouncing is helpful. It's like joyful things. I would imagine even like being on a seesaw or a trampoline, if it's safe, the rebounder is a thing to help with moving the lymph fluid through the body, as well as laughter. So it can be a really, no one likes to think of having to deal with something for the rest of their life. So if these therapies seem very practical and they can get on with their life and with ease, then it just naturally becomes kind of a thing that they can do every day. All right, so this is not a conclusive list, but I thought, okay, well, we're all acupuncturists, so we kind of just want to know some points. So, okay, so so local, this is for lower body. So points to consider would be stomach 36, because it's like our command point for the abdomen. Spleen 6, it's a meeting of 3 yin. Spleen 9, a great point for dampness, whether it's substantial, non-substantial. It can help emotional well-being. Kidney 7 is like the yang of the kidney points. Stomach 40 is addressing dampness, and then all the Ashur points. So a point about local needling. I think and this is true at like City of Hope, and I think for like Western medical practice of acupuncture, we're not needling in where there's edema. You can surround the edema, but you're not needling into the edema. And I know maybe there's people that needle into the edema, but we have to actually grade the edema. So grade 1 through 5, whether it's like how soon you get the rebound. So grade 1 is like there's a quick rebound. Grade 2 is when it's just slowly, and then it's like 15 seconds or 30 seconds or a minute. Yeah, with the pitting. So when you put pressure, like how soon does the skin does it come back? So, and the slower that it comes back, I would be very cautious of like needling into that area, because it's just going to be really prone to infection. And that would be an opportunity, if I was in private practice, perhaps to do moxibustion instead. And I actually probably wouldn't even acupressure. I would probably do, I don't know if anyone studied Peter Holmes, like the essential oils on the acupuncture points. He calls it acupoint therapy. Maybe that would be a modality to use for that. Yeah, so pitting edema, swollen areas of edema. If it's an arm that's swollen, if you can get into like the bony areas, okay, but not into like where it's actually swelling and swollen. Any thoughts about that or questions about? I was just curious. I mean, because it's kind of a long learning curve for me for that one. Yeah. Yeah. Yeah, I think that's important because I've been very tempted by like long-standing edema, like gallbladder 40. Like, let's make something happen here, because this is like, it's cold and needs help. So usually, again, there's a place where you can get into that area around where the swelling. I wouldn't try to like the top of the swelling, but I kind of remember when I was as a student where we surrounded it and then we put one right in the middle, right? Am I not remembering? So, but I would use moxa, but I would probably surround it, and I would use moxibustion and see if you could get movement that way. Um, yeah, like a stick pole moxa. Or you can use the Japanese, maybe one at the top, little tiny, or like a moxa cream or spray or something like that. I think there's still a lot of research that needs to happen with like what works best in those cases. Okay, so systemic support, not that these local points wouldn't have systemic support, but let's say, they have a really swollen limb. So yeah, when I've had a swollen limb, I tend to not needle where there's swelling, and I'll needle the other side, or I'll use something like a systemic support. So if I can get to the abdomen, I'll needle the abdomen, RIN 4, RIN 12, stomach 25, LI4, LI11, Sandgel 5, using that pair as to opening up the diaphragm and thinking about, cisterna chyli, moving lymph that way at its main pump or reservoir, and then gallbladder 40. There are different thoughts about what meridian most speaks to lymphatic fluid. Is it the Sandgel? Is it the gallbladder? Is it the spleen? Is it the kidney? So if you read Spark in the Machine, Daniel Cohen's book, he really passionately speaks about the gallbladder meridian because where the gallbladder sits and its proximity to the cisterna chyli. But he doesn't really go into about lymphedema. It's mostly, he gives an example of a headache, and he talks really more about the anatomy of the gallbladder and the pathway of the gallbladder and in relation to lymphatics. So I'm not convinced. I mean, I don't know. I think the Sandgel probably most closely, but in order to make change, you really have to engage the kidney and the spleen as well. So I think it depends on how the person presents and what they need at the time. Okay, so that's lower body. Upper body, local areas, and these are, it's missing a point. So local, in the Kaselev study, they used LI15, Sandgel 14, LI11, Sandgel 5, LI4. So sorry, Sandgel 14 is missing. And then systemic support, stomach 40 is missing here, but stomach 36, spleen 9, spleen 6, lung 7, I put lung 9 because that's more like governing everything, being the tonification of the lung. Lung 7 is more pointed to immunity. And RIN 17, opening up the chest, and RIN 9 being a key point for swelling. Any thoughts about other points to share that have worked well for you when working with lymphedema in clinic, like upper body or lower body? Yeah. Yeah. Oh, yeah, yeah. Great. So UB 39, UB 40. Yeah. Yeah. Those are points that are okay. So are you able to use UB 39 face up? Oh, okay. Yeah. So you just haven't bend their knee or have it on a pillow. Cool. All right. Or sideline, you can use UB 40 too. And kidney tin too is pretty clear. You can use it when you're face up. I didn't include, I like to point out that, when I get to cisterna-chyli, then I'll talk about kind of interesting that the backstreet point for the sand gel is kind of the same place. All right, so breath work. So if someone has lymphedema and they're looking for practical ways in which to make change, I think you really need to see how they breathe. I don't know if you don't do that already. I think that's a really good place to start when the person's on the table, or if you're going through your intake. How are they breathing? Are they taking some abdominal breaths? It's very easy for me to take an abdominal breath because I played clarinet for most when I was a kid, and I was that was my undergraduate. So like, for someone who's like, it's easier for others than not. So I can't even imagine like not being able to breathe from your belly. But there are people who haven't done like musical training or singing or things that ever require that to engage their abdomen. So this is a perfect time to really to teach how to engage the abdomen. And we've all learned that with our Qigong and Tai Chi. And you don't have to be any sort of master at it. I think it's just teaching some basic diaphragmatic breathing, or just doing some self-study as a practitioner to, if you're going to work with people who have lymphedema, I think it's just helping people being able to take deep breaths. And that's something they can do when they're just walking around, or when they're at home doing anything. It's always a nice opportunity. Just today at the hotel I was staying out, the coffee cup said breathe. I was like, I'll take that opportunity. Like it's always a good time to breathe deeply. So I just want to point out, I mean, I haven't done a whole lot of Japanese acupuncture, but there's like a whole hara component in different parts of the abdomen. Then there's the Qigong, Tai Chi, and yoga. So there are aspects of breath work that we can bring into the practice and teach our clients so they can make effective change. And in fact, the self-care, if they go through conventional therapy to do manual lymphatic drainage on themselves, always begins with the abdominal breaths. So that's like always the first step. So you'll be reinforcing what hopefully they have learned. And if not, what you're teaching them, they'll learn in their conventional therapy. So there will be a nice crossover for them. Sometimes people need to hear it several times. And so with the breath work, you're actually doing something really positive for the lymphatic system. You're engaging this pump called the cisterna-chyli. It sits a little bit to the right of the aorta. So the cisterna-chyli is the main pump. It acts as a lymph reservoir. So it collects fluid from the intestines and chyle and from the lower body, and then it'll channel it to the thoracic duct. So, and then it also, I got this from Spark in the Machine, fluid around the gallbladder also drains into the cisterna-chyli, and that's why, the gallbladder is considered the channel of lymph in Spark in the Machine. Its proximity, the cisterna-chyli's proximity to the gallbladder. So there are different ways. There's so many different, I would say just pick one that resonates with you. But a basic one is we can all just put our hands on our bellies now. We just practice like a basic breathing. And I would start just by letting the patient just like quietly observe, like breathing with them, and just starting from a place of like observation instead of, with your hand resting on your belly, just becoming aware of your breath. What does it feel like for your body to breathe? How does your body move when you take in a breath? And if you're noticing any tension, when you become aware of your breath, just letting yourself breathe into that tension and letting it soften on your exhale. Now we just begin with the nose. What does it feel like for your breath to enter your nose or your mouth, whatever you choose? This is for someone who isn't breathing in through abdomen. And then with each inhale, just being a quiet observer of your chest and how that's moving. And as you take a breath in, let it fill your chest. On the exhale, give yourself permission to just let your neck and shoulders soften. So here we're teaching them to disengage those secondary respiratory muscles at their neck. Continue to breathe in from your nose, inhale, and on the exhale, just let everything soften. And bring your awareness down to your hands at your belly. And this time, let your breath travel, the inhale travel from your nose into your chest and down to your belly. Let your breath expand your belly. And on the exhale, let your belly and your whole upper body relax into the exhale. And let's do that together for 3 breaths. Great. And then as a practitioner, I would be observing them, giving some positive feedback to what you noticed, and because there's no right or wrong way. And then ask what it felt like. And if there's anything that you noticed, any tension, asking them to breathe into that tension. And remembering just to exhale, releasing the tension, or inhale and then exhale, releasing the tension. So that would be your diaphragmatic breathing. There's other ways of doing it. You can actually have your hand at the stomach and then breathing into the tension and then letting your hands follow the exhale, going deeper into the abdomen and doing that at 3 levels. And then the third one, you can have it just like a release. So that's part of manual lymphatic drainage, is that when you're breathing into the abdomen, at some point there's this rebound. So it feels like a little bit of a trampoline experience for your abdomen. It helps kind of engage that pump. So, but I told we were going to talk about the acupuncture. So I didn't really prepare a whole lot about that, but any other ways in which you teach breathing to your patients that you think would be helpful for lymphedema that you'd like to share? I find that, Nishanga?
Just one thing I do around breathing is I do take pulse, and I'm always looking for a diaphragm block, and it's a Shen hammer concept of pulse, but it's easy to pick up where you feel, if you go between the Sun and Guan pulse, you can feel like a road bump in between those. And it's super common because how many people are sort of repressing their deep breathing, right? So when I find that, oftentimes I'll do lung 1 and liver 14, and I'll do it in kind of a contralateral, like an infinity sign way. And usually that will release the diaphragm. It'll open up that block and it'll change their breathing. So,
Oh,
and then of course, teaching them breathing definitely, but some people like are so used to repressing their breathing that it's really hard even to learn to breathe. Whereas if you do a release like that first, then they can engage in exercise like that better. So that's one reason to do pulse.
so that's very interesting. So you'll feel like a little bump between the Sun and the Guan, like a tightness that indicates tightness in the diaphragm.
Yeah.
And then you'll do like an entry exit, but in a cross
Exactly.
pattern.
Yeah,
Okay.
yeah, like an entry exit, and it's a fun treatment to have, because it really opens up the chest, and your breathing pattern really changes significantly. So it's not, don't try it needling it on yourself, but on a friend.
Okay. Well, that's nice. Okay. Is there anyone else that breathing techniques or acupuncture, working with the breath? I think that's a really good one. I mean, pericardium 6 and stomach 40 also relax the diaphragm. That's kind of the magic of those points. I remember learning that in school, and that kind of blew my mind. And that's how I really relate to pericardium 6. And that's how actually it really, even basic science shows that. So that's nice. I think Cochrane agrees on that with us on that one. So, all right. All right. So you can engage the cisterna with these qigong exercises of diaphragmatic breathing, also the postural movements. So those spinal rotations, we're opening up the kidney and opening up the spine. You can also think of that in a new light as really working with your lymphatic system, and also bending. That squeezing of the retroperineal region. Also, so like today when we did the laughter and we went down and came back up, that's also giving a little squeeze to your organs and your cisterna chyli, helping move lymph fluid, and supporting drainage. And also the qigong, just the whole relaxation response. So that I think that's where really it can't be underestimated. And even if someone just comes out of a treatment relaxed, that's sometimes it's what they needed. And that has a beneficial effect on the lymphatic system, because it's taking them out of that sympathetic mode into parasympathetic. So they're helping their metabolism. It's an accumulation of these proteins and gunk in the lymph fluid that need to be transformed. So putting them in a parasympathetic, letting the body metabolize that is helpful. So there are more specific qigong exercises. So I just put that in here. I'm not a qigong master, but I put that in case there was someone here that knew, the bagua or qigong. I just want to, yes, that's all very great to show your patients if you feel inclined to do so. And again, anything that's going to, like the gathering qi to the dantian, that's kind of what we were doing earlier. That's helpful. Building spleen and kidney qi to transform fluid. So food as medicine resources. So they're all the foods that help with dampness. And I would, you can look at Paul Pitchford's book for that. I wanted to kind of open this up for discussion, because that is something that haven't been focused on. That's something I can't even chart about, actually. So what's ultimately very helpful, and I've really surrendered into this, it's an idea that comes from Donald Abrams at UCSF, and that we can actually point to the National Cancer Institute guidelines for mostly plant-based diet. And if their diet, really for proper diet and food, we should look not should, but it's helpful to look at the blood work. Some chemotherapy, some medications, you have to watch what certain potassium, certain this, certain that. So it's not helpful to tell someone to like eat a bunch of broccoli and Brussels sprouts when maybe their diet doesn't allow that. But mostly plant-based Mediterranean diet. I would also, very important is to stay properly hydrated. I think people have this misconception when they have lymphedema that, if I drink more fluid, then it's going to make me swell up more. And actually the opposite is true. So they should be drinking adequate amount of fluid and maybe, doing something with teas. We should be helping them with their elimination too, if they have problems with constipation, elimination. So, and then there are more specific these are resources to look into if you wanted to actually put like a meal plan together for someone with lymphedema. So I've added those. Any seaweeds are good, bone broths would be good. Dark leafy greens. Avoiding any even processed natural foods, like all the yummy natural snacks that have been processed for us and sold as vegetarian, gluten-free, yummy yummies. Those aren't good either. So you really need like that plant fiber and the micronutrients of fresh fruits and vegetables. But it really can be that simple. So it doesn't have to be, if they want to add, it'd probably be cool for them to, dandelion's very bitter, but sometimes you can find it fresh and mix it in with stuff. If someone's very spleen deficient, they probably want to put warm grains or proteins over that, or to sprinkle it in like a soup instead of telling them to eat a bunch of greens raw. So that still goes. So, be mindful of what their constitution can handle. And then what do they enjoy eating? Like adapting start where they are. What do they enjoy eating and making a small change or adding something instead of taking away something, adding something. So I'd love to open this up for any nuggets of information you'd love to share with the group about food and beneficial foods for someone with edema or lymphedema that you've used or come across. It's really kind of it's more of integrative, highly trained integrative nutritionists. It's not really something that's put, advertised. So then I have this person needed to build their blood. So this is kind of like something you can something like a Paul Pitchford kind of thing. You can write some things down for folks. All right, then I was going to talk about essential oils that I've used. The big ones for essential oils, and this ties in with herbal medicine, is juniper and grapefruit. The nice thing about juniper berry is that it's not phototoxic, and grapefruit is. So grapefruit, you have to be careful if they're going out into the sun. But if you're just doing abdominal massage, that'd be a great place to use. This was for someone with lower leg edema. And so she was wearing yoga pants in, yoga pants out. So she wasn't going to have any photosensitivity. So this blend of juniper berry, grapefruit, cypress, and sweet orange is nice. Any essential oil blend that addresses immune function. So frankincense, eucalyptus, sweet orange, lemon, clove, all those would be good. As well in a separate blend. When I'm making a blend, I try to keep it to like 3 to 4 to start. And then case studies, and these are mostly case studies with manual lymphatic drainage, but lymphedema, I'll just go quickly through these. And so lymphedema shows up not only for, breast cancer survivors or people in breast cancer treatment, but something like follicular lymphoma, where there's swelling in the axillary area and the abdomen pretty severely. And this person actually just wanted to have manual lymphatic drainage. But if I was going to do acupuncture, I would have picked some of those systemic points. She ran pretty hot, so I wouldn't have used moxa. That would not have been something she would have come back for. Let's put it that way. So I would use stomach 40, maybe first treatment, maybe done the Luos, gallbladder 40 and, our back treatment. Oh, I wanted to mention earlier, it's really I love how there's always this something as ancient as Chinese medicine and Western medicine. Do you know that the sanjiao, the back shoe point for the sanjiao is exactly in close proximity where the cisterna-chyli. Cisterna-chyli lives around the first lumbar vertebrae, and that's where our UB22 is. So how did they know? So that might be easy to remember. So if someone has some swelling, you're going to treat the kidney. So just go a little higher and treat the sanjiao too, and then spleen. Okay, so with any MLD treatment, you start with the abdomen. So if this was an acupuncture treatment, I would start with some breathing, and then with the face-up treatment, and then use those points. Sometimes, because I was in private practice, I will do lower body points and then continue the manual lymphatic drainage. So this is sort of a hybrid. I don't know if anyone else does this, but leaving points at the lower body, but then doing some body work on the upper body and then switching. The way I used that because I received that and it was so effective, and maybe because I just love massage and then adding acupuncture. Yes. So, yeah. So with MLD, you'll start with the abdomen and then you'll open up the terminus, and then you'll start where the person has functioning lymph nodes. And then you're opening that, and then you're draining into where they're congested into where it's open. And so I would just proceed with the MLD and just do acupuncture at the lower of the body. And then on the back, I'd probably do a back treatment, continue to work on the neck, take the needles out, and then finish with the MLD on the back and legs. Yeah. Yeah. Yes. Yeah, so I learned it as a terminus, but sometimes it's not even mentioned as a terminus. So like the thoracic duct, but it's like where the triangles are. Yeah. Yes. Yes. Okay. Yeah, I'm happy to go over that if that is okay, because we're doing acupuncture, but it goes along with how the lymphatic fluid moves. Yeah. Yes. I do them both. So I'm going to grab this. So if you notice on this lady that she has these quadrants. Yeah. Yeah, so you'll notice with this lady, and I'll draw this on myself too, that the body is divided into quadrants. And we learned earlier today that the cisterna-chyli drains everything into like all the lower body and the left side of the body into the thoracic duct. So the cisterna-chyli helps pump everything back up to the heart and via the thoracic duct. So it's kind of collecting everything from the lower body and bringing it back up to the thoracic duct. And then the upper body works with the right subclavian. So the terminus, I've learned it as a terminus, that's both the right and the left. So with manual lymphatic drainage, there's actually a whole abdominal protocol, but basically you're just getting the pump going. And I would probably, just to make it simple, just work clockwise around the abdomen. So the sternocleidomastoid sits a little bit to the right of the aorta, but I would just work clockwise because that's the way in which the bowels move. So it's going to feel nice anyway. Right, because that's the second that's where it's going. So those are the two main flow areas. So abdomen for whole body and mostly lower body, and then the thoracic duct for the whole upper body. Yeah. Yeah. But I think it's a great question because if you're short on time, I would still make sure that there's always time to teach abdominal breathing. I think that should be just like a beginning intro to make sure they're able to breathe for their abdomen. Yeah. And then have that connection with them, with like breathing with them and being connected with their body, and you're connecting with the intention of the session. I think it's really beautiful, like when people take time to do those small steps with you. I like that. So I don't know. No one likes to feel rushed. They don't know about like all the points you're thinking about what would work. You know, actually, if you could just use a couple that it probably in work, that would probably make them really happy. You know, I kind of learned that the hard way. I kind of, that you don't have to rush. And having more of their personality fill the room, like and you're facilitating that. So I think breathing is a great place for that. And especially when we're talking about lymphedema, it's like the place that has to start. So, okay. So then you open up the thoracic duct. Okay. Let's say, so there's been a big change in how manual lymphatic drainage is taught and practiced. And it's because of this research that's come out of Canada and the ALERT study. So basically, even if you've had lymph nodes removed, there are still lymph nodes that are working. And so the research shows that we shouldn't avoid that area as body workers or clinicians, that we should actually really be getting in there. Like not aggressively, but you can get in there and do pumping there. But because I was trained the old school way in which you opened up okay, so let me just break it down. Let's say, so we're divided. Yeah, sure. So we're divided into quadrants. And the lower body is right at the belly button. And it's just right down the middle, like the red line. Let's say I have right breast cancer, and I've had some a sentinel node removed and some lymph nodes removed here. So, and I've had radiation here and, right mastectomy. So I'm going to do I'm going to engage the abdomen. I'm going to open up the neck, and then I'm going to open up the healthy side. And then I'm from the healthy side, I'm going to work my way to where it's most congested. So everything's open, and where it's most congested, now it can flow. So if we don't open everything and we go right here, it's just going to clog it up more. I don't know if that makes sense. So, yeah. Right. Manual therapy. For acupuncture, you could probably think about it in the same way. So the question is, what kind of a stroke are you using? So for manual lymphatic drainage, different schools of thought on that. So I would start gentle, just kind of like what we did today, and just a skin pull. Actually, everyone would agree, I think, in the lymphatic schools. I learned from the Close Institute, you want just enough, and if you can practice on your arm, just enough for you see the skin pull. So think about engaging like the Luo or the Wei Chi. You just want the skin that's on top of your muscles. That's what you want to see move. you don't need to go deep into the muscle. So the lymph is actually the lymphatic vessels are, they're in the space between. So that's nice too. So it's less is more with that. When you're pumping in the healthy armpit, it's a kind of a pressure release in a semicircle. So pressure release, and then it's usually I would have to show you. You can just do a little bit of, when they're doing their own self massage, it's a pressure release. So little semicircles, pressure release, and it's just a skin pool. So then you can go from sternum, pressure release, or you can go hand over hand, just getting a skin pool. And you actually don't need to make it, when I first learned lymphatic drainage massage, you know what, with effleurage, you keep it going and it's a constant connection, or lomi constant connection. But with lymphatic massage, you actually want the release. So you want the pressure and you want the snap back. But so it's okay. I wouldn't disengage, but to have that snap back is actually helpful. It's kind of like if you're jumping, there's a snap back. So with your hand, there's this snap back. So that's good. That's two. Yeah. Yeah. I mean, of course, consent all the way, because you're going to be touching them fully. And sometimes people come with the expectation that, okay, this acupuncture is just, it has a certain feel to it, and you should let them know, or talk to them about, if they would first and ask them what kind of self-care they're doing or for themselves. And then this is an opportunity to support them in their self-care. And then to show them that self-care. And then I also have a handout that I've created that goes through these steps, and it has pictures, and I'd actually grab the pictures from the Canadian universities, but then put my language on it. So the information's out there on how to do the self-care, and it should be actively taught. So if someone who's especially if gone through like aggressive treatment, like lumpectomy, mastectomy, and if they haven't gotten any sort of therapy, I would really, I don't know, it's probably a lawsuit involved there, because they should be, you have to. Are they overall and they don't remember? They don't remember. Yeah, probably a reminder. Yeah. So anyway, so nowadays you can go and you wouldn't skip this part. So in old-fashioned MLD, you would skip this part and you would actually move down into the healthy inguinal nodes, and you would just kind of this would be a no-go zone. Nowadays, though, you can, once you get to the affected side, you can do some gentle pumping. Feel if there's cording, feel what's going on in there. Feel if they, and I haven't been trained on scar manipulation. I think if I was more of a body worker, I would get all into that, because sometimes, especially in private practice, they show up and they want you to, like, especially if they've had all the surgeries to reconstruct their breasts, they need some help. They can't even, it feels very foreign, and they want someone to help get the tissue moving so it doesn't feel like armor that they're wearing. So I have to say that that's where my expertise stops. I haven't really there are people who do that, like work with the breast with people. So I haven't done that, but I work with scars all around. And I have worked on chests that have no breasts and things like that, but I don't do that on a regular, only if someone asks. And there's a whole consent process to that. Yeah. And so let's say someone has, any questions? I think the main thing is just knowing where the quadrants are, knowing where the affected side is. Let's say if it was lymph nodes at the neck, let's say left side removal of some cervical chain lymph nodes. So you're going to do the abdomen. I would do maybe some light opening of the terminus, but then you're going to really focus on the axillary, because that's really where it's going to drain, and then come back to the neck. Before you start working the scar tissue and working the neck here, you really need to open up the axillary. and opening up the opposite side and then get in there. If it was, ovarian cancer, they've had maybe some radiation here. There's swelling on some affected side, the left side. You're going to open up the abdomen. You don't have to worry about the axillary so much. You can actually save time and just focus because the lower body is going to drain. But you can do the abdomen. I like to do determinus because it really helps relax the body to work on the neck anyway, the neck and shoulders, and it doesn't take that much time. And then go to the non-affected side, and then the affected limb. Usually it's going to be a lot of swelling around the ankle. You're going to start at the inguinal and then work your way down and go all the way back up. So I first learned this like several years ago. So it took me a long time in practice so if you're able to grasp this, like that's amazing. Yes. Yes. Yeah. So if you read certain editions of the Paul Pitchford book, it still has this line about the spread of cancer through massage. So yeah, you found it. Yeah. Yeah. That one really stumps me. Like, oh no, it's not true. So I'm a massage therapist before as an acupuncturist, and I did my training in 2007 and did an oncology externship, and definitely we're not spreading cancer through massage. The only way you can aggravate cancer if you are like you should know where the active tumors are on the body. So that's like an active area of inflammation, and we don't want to aggravate that. So that's why it's really helpful to work in a healthcare system, to know everything, where everything is. And sometimes when people come into your private practice or clinic, they're not very clear, but really, yeah, you need to be clear, especially going to do laying hands to know where their tumors are. If they've had, yeah. I even find that people who have bone mets, depending on how deep the bone mets are, with acupuncture, that you can still, because we're not going all the thoracolumbar fascia is so dense and thick that we're not going to be aggravating the bone mets. Yeah, but I still feel more comfortable if I can actually read the CT scan to know where they are exactly. Because, I really wouldn't want to do any harm to that person. So if someone is in active cancer treatment for body work, you're going to be as gentle as possible. And you can do a lot with hand and foot massage too, like thinking of the microcosmic holographic aspects of the body. So I would really go there first. The question is there any evidence that we can damage lymphatics with deeper touch? So the thing is that with deeper touch, depending on how that deep touch is done, you're not going to be moving as much if you were with a lighter touch. But that being said, like someplace over the calf and they have in the ankle where someone's had a lot of swelling in their, and then stuck fluid, lymphatic fluid, I find that you do need deeper touch, but it's a type of touch, it's kind of like needle technique, so it's not down, it's a C, you're scooping you're scooping and you're moving. It's a certain type of technique, and you're working around the joint. And I would still kind of use a combination. I'd use deeper. And then with the deeper, you're always going to drain. So if it's, let's say it's the lower leg, it's a great opportunity to go into the popliteal. The popliteal actually is the place where it's really draining. So behind the popliteal fossa. And I thought I had some images of this. I don't know where I have to find it, but so they've done radio scans of the body. And so to be most effective, I would look at those. They should be up there, but so it doesn't run just like in a linear aspect. So it goes from, so if you're going to use deeper touch, I would really try to maximize where your draining points are. So you're moving it into a drain. So that would be your inguinal nodes, your popliteal fossa, the nodes there, in the cubital crease, the axillary areas. So if you do have to use deeper pressure, let's say on the middle of the body, then you need to move it into the lymph nodes and not just stop there. So I don't think it's damaging. It depends. If you'll know that it's effective, you'll know that it's damaging. It'll get red. It'll get more swollen. There won't be any change. But after, it does take time. It's a very repetitious hand technique, but you'll see that a slight reduction is going down, depending on the type of edema. I've seen, you might see more, you might see slight, but it should be reducing and not getting redder and more irritated. Okay, so that was lymphoma. This was someone who had right inguinal, right leg. The entire right leg was swollen, but it was a chronic condition. And she was actually from Austria, and she used these smooth. There's a certain type of thing, this little vibrating thing. I don't know if that helps with lymphedema. And the product is really interesting. And she was a trainer for that. And that's how she dealt with her chronic lymphedema. She knew that she would just do these exercises every day and teach others about these exercises. She was a really neat lady. So again, I did MLD, began supine with abdominal breathing, abdominal MLD. Then because it was on the right side, I started with the left, the non-affected, and then I said drain. Then you drain the right, right upper quadrant. There's some more cases. I'm trying to see if I can find the picture. Here it is. So I had a patient who had chronic swelling in her leg, and they didn't know what it was from. At the highest level, they had no idea what it was from. So that's really frustrating. So she had this lymphoscintigraphy done. And it showed that there was a delayed dermal pattern around the medial right knee and upper thigh, indicative of abnormal deep channel lymphatic drainage of the right lower extremity. And then she also had this sonogram done, which tells you what's the rate of the return. The big thing was that she didn't have a DVT, but there was this slow return on the right lower extremity. And then I'm going to show you, this is how the lymph is flowing. This is this is a cadaver, but same applies for living body. See the red line going to the leg second from the right is the popliteal fossa, and so that's a really great area. So I think you're right on when you talk about UB39 and UB40. because it drains most in that area to the return to the inguinal lymph nodes. And then look at the pathway for the inguinal. If you go to a far left, it's the pathway of our 3 yin channels. So that's why I'm confused when Daniel Keown talks about the gallbladder being the main lymphatic channel, when on the physical body, it's actually these 3 yin here. And if you're looking at the lateral leg, that's on the far right, there's not so much activity going on there as far as like lymph nodes go. But maybe he's thinking more systemic, like the gallbladder draining into sternochyly, more of like the abdominal aspect. So, sadly, people will get lymph node transfer surgery. So when the lymph nodes are not working, then they'll take lymph nodes from some part of your body and surgically attach them to places where you need them to work. And sometimes it works and sometimes it doesn't. So that was the case of the 62-year-old female, lower leg edema, left foot pain, right hip pain, thumb pain. This was that I could learn a lot from community acupuncture. This person always had a lot of things going on, a lot of real things, a lot of different roots, a lot of different branches, depending on the time, how you're talking about them. She used to ride horses. She really wanted to ride horses. She had had ovarian cancer and then was struggling with the lymphedema for half of her life. She underwent lymph node transfer surgery, reconstruction surgery on her left leg, as well as reconstruction surgery on her right hip in the same year. She reports that her right hip is feeling much better. And that was just like another thing that wasn't really because of lymphedema. That was because her left leg had been bad for so long and it had compromised her gait for so long that it kind of blew out her right SI joint, her right hip and everything. So the goal of the transfer surgery was to remove buildup of the lymphatic fluid in the tissue in her left inner thigh. As a result of the surgery, you'll see this commonly as like an S scar on the medial side of the left lower leg. And they transferred lymph nodes from the omentum over the liver to that area to see if they can get that to work. And she said that her left leg is much better. It doesn't swell as much as it did before the lymph node transfer surgery. So that was good. Then she was having left lateral foot pain because of the compression bandages she was wearing. It was causing like this friction pain. And she had chronic thumb and wrist pain from having to use a cane before the surgery. So I surrounded Dragon with the thumbs and did these points just because they're more local. I think I'd probably choose different points today, but the treatments work really well for her. And then this was a patient that combined acupuncture with MLD. So I find if you're going to, if you like working with people who have a history of cancer, that adding MLD to your toolbox is really rewarding. I mean, it allows you you just learn more about the body. You're able to, especially people who are needle sensitive, you can provide them with something. I mean, I just find it interesting and it's very helpful for folks. So, and that's the last of my slides. Thank you so much for allowing me to speak this long in front of a mic.